Hi, everybody. Thank you all so much for being here today. I'm Gina Capidu. I use she, her pronouns, and I get to be one of the program coordinators with Kids Mental Health Pierce County. We are so excited to partner with our friends at Behavior Bridges to do a webinar today about preventing behavioral health crises for neurodiverse populations. It's no joke because it is April 1st, so happy April Fool's Day to everybody. I want to give as much time as possible to our friends at Behavior Bridges to present their content today. So I just want to give a real quick overview about Kids Mental Health Pierce County and Kids Mental Health Washington for those of you that are new. So Kids Mental Health Pierce County serves Pierce County. We focus on youth kindergarten through 12th grade primarily, regardless of insurance and regardless of what type of behavioral health resources they're looking for. We really believe in the power of community and partnership, which is why we want to uplift the great work that's happening in our communities just like we get to do today. We are a community coalition of over 70 organizations locally just here in Pierce County that are working together to support youth and families and each other. We have expanded statewide as Kids Mental Health Washington. I see some people here that are from outside Pierce County or serve outside of Pierce County, so you can always access our services that way. So I just want to be able to go ahead and get us started. You should be seeing our behavior bridges presentation slide here. What you're going to get at the end, we're going to ask for a very quick, and I promise it's quick post-training webinar survey because it helps us get the information of what types of information you want us to present for future content and presentation. So we're going to ask you for that. So that's the last disclaimer that I have. I want to turn it over to our friends at Behavior Bridges. So Laura, I'll turn it to you.
Sounds great. Thanks, Gina. All right, I am going to share my screen and see if we can make this work. How's that look, everybody?
That's great.
Excellent. Okay. Hi, everybody. I'm really glad to be here. I am the owner and executive director of Behavior Bridges, and we have been around for the last 11 years, providing behavior supports and preventative services throughout the Pierce County and surrounding areas. We've been proud partners with Kids Mental Health Pierce County since its inception, and we're excited to talk to you today. With me, I have our client transition specialist, Jonathan Ojeda, who's going to be my co-presenter, and he'll get a chance to talk in a few minutes. So what we're going to do today is we're going to give an overview of a program that we've been running for the last 4 years and some updates as to some new funding and some new access points that people can use to utilize preventative behavioral health services through Behavior Bridges and other services so that we can try to have a great spring and summer with as few crises as possible. So just a little bit about us. We provide behavior supports, but we also, our main mission is to help people overcome obstacles together. Being part of a community is the cornerstone of everything that we do. We can't do anything alone. We have to work together as a team. And so our goal at Behavior Bridges is to make sure that everything we do works, that it's a quality service, and that we serve the lifespan. So our youngest in our programs traditionally have been around 2, but we are able to serve younger, and we've served people all the way into their 70s and beyond. So it's really important for us to be able to serve that lifespan. I was talking to a parent earlier today, and they have an almost 18-year-old, and was talking about how they just didn't know what was available. And it was really exciting to be able to share that, you can come here to us, and we're available. And so that's really exciting that we get to share some of those programs that we can do for you. The other thing that's really important to us is to make sure that everything we do, it has to do with dignity and integrity for the people that we serve. And finally, collaboration is at that center, because we can't do anything that's going to be lasting positive change if we're not doing it together. And so our philosophy is that everybody has the right to reach their potential, and we collaborate, and that's how we do it together. And everybody is a valued member of the team. So everybody's equal. There's no lead, there's no boss. and if we really wanted to go with it, it'd be the person that we're all serving together. But everybody else is an equal member of that team. And we only do stuff that works if we work together. We are in Puyallup. And if you go down Meridian, and you're familiar with Meridian, it's quite long, but we are about 3/4 of the way south on Meridian. And if you know where the Dairy Queen is, and you know where Sunrise Shopping Complex is, and you know where South Hill Library is, then we are right there. If you go through the drive-through in Dairy Queen, you can come on by and park and say hi to us. Our service area, it depends on our services, and I'll get into that in a little bit. But generally, our direct one-on-one services are within 10 miles of our center. All of the services that we have funded through Pierce County are, of course, for Pierce County residents primarily, but we also have funding and access points to serve anybody throughout the state and beyond, if that's what's necessary. Our goals at Behavior Bridges are to make sure that everybody feels safe, that everyone feels welcome and supported, to make sure that people have access to resources. While we're not a resource hub, we do want to make sure that when people come through our doors or call, that we're at least able to give them somebody and that warm handoff to somebody else, so that we're not saying, nope, sorry, call somebody else, this isn't the place. We work really hard, and Jonathan's whole position is to make sure that people have a way to have partners in. We don't know, but we'll try to find an answer, and we'll try to at least introduce you to somebody who we think might be able to help. And that's because we are a community, and we're a community together. And Kids Mental Health Pierce County is a great example of how networks and community working together creates fantastic positive change. And so that's our goals as well. And when we do that, the idea is that people that come through our programs can learn valuable skills that promote safety and social well-being across their lifespan. So one of the other pieces that's really important to us, most of our staff are behavioral trained or psychologist trained. And so evidence-based principles are really important to us. We don't want to do anything that is just like, I really thought peanut butter was a really great idea to reduce that behavior. There's no evidence to say that. So we're not going to do things that research hasn't supported. So everything that we do has a base in research and a base on this has been effective, and this has been helpful, and that it's to date research. The other thing that we want to make sure is that we're providing continuous practice updates, so that making sure that those things are up to date. I just ordered a whole bunch of new books of some new assessments for adults. And so everybody was very excited to get those. I also ordered a book on idioms, which people were equally excited about. So it gives historical context to what things that you say mean. So I have some really cool literal people that are very excited to learn about that. All of our interventions are high quality. I try not to hire duds, as I say. And so I'm really proud of all of our staff and everybody that's at Behavior Bridges. It's a fabulous team, and everybody's providing really good quality services. We're also members of the Council for Autism Service Providers, which is a national nonprofit that partners to identify what the best service providers in autism supports are, and what those trends should be. And I'll be going to that conference at the end of this month as well. But I'm proud to say that we're CAST members, and we've been accredited at local and national standards. And so we're really happy to be able to say that we can do that as well. The services that we provide at Behavior Bridges, we do provide ABA services. We also have groups, staff training, caregiver training, and education consultation. And so we're going to go over what those things are and what those things can do as we move along today. But this is the crux of the supports that we can provide. And we'll have opportunities for questions after each of the services if anybody wants to ask them. So ABA therapy, our our philosophy with applied behavior analysis is that it should be meant as a team, and it should be meant to provide improved quality of life for the people that we're supporting. And so all of the interventions and supports that we provide through this service are tailored and individualized specifically for that person, for their family, and for the circumstances that they're in. And we use strategies that are really designed to be proactive and positive, to create positive quality of life changes, and that are important to that person. And so it's not what we think is important, it's about what that person needs or would like to work on that's important to them. What we're doing should be meaningful, and it should benefit their growth, not what we think they should be doing or what their growth should be. All of our ABA services are individualized. We provide focused ABA, which is, a little bit of, we pick a smaller amount of goals that we're going to work on. We also provide comprehensive ABA services, which is that more intensive treatment model. And we're just about to start doing our short-term consultation model as well, which we're really excited about. All of our, and then the pictures you see are places that we have gone in our services. So a couple months ago, we went to Target and did a preference assessment on what things are you interested in, and kind of went one by one with all of the activities, and that person is using their device to communicate what things they're interested in, because we needed updates. He's older, and we were like, hey, interests change. What are you into now? So we went over to Target and we checked. But we provide in-home based ABA, center-based ABA, and then we also do ABA within our community. And that is a service that we provide within 10 miles of our center. Why? Because Meridian's a big place, and we want to make sure that we're able to serve you rather than sitting in traffic. Here's just a few other examples of our center. I know it's important for people to trust where they're going and what's happening. And so I think it's important for people to see what's happening. We also have a virtual tour on our website that has more pictures if you're interested. But as you can see, the space that we have really is meant for all ages and meant to be safe and welcoming and not feel like sterile. It's meant to be comfortable and fun and for people to have a good time. And we're about to do our spring break programs, and it's going to be packed. We also, if you see the bottom right, Jonathan's going to talk a little bit more about this, but we have a resource area in our entrance so that whenever people come through, if there's things to know about that are part of the community or resources, we have a resource area. And then, of course, we also have Jonathan who can follow up with anything. And so those are all just components of some of the services that we provide individually. For our ABA services, we do partner with a handful of private insurance companies. So we are able to take Blue Cross programs, including Regence and Primera. We're newly credentialed with Aetna, and we've had a long partnership with Kaiser. And then we also accept private pay. Any questions about ABA and those services? Okie doke, I'm moving on. I hope you like my memes. All right, or gifts. I guess they're gifts. Okay. Ryan, we do not accept Medicaid or Medicare for our ABA services. And Rebecca, thank you for those questions. We aren't able to do that with our ABA services. However, the programs that we're about to embark on are all free and available to anybody, and including including the groups, our courses, and our caregiver trainings as well. So those are things that we really try to focus on. We also provide school district consultations, and many times those services through schools, through employment agencies, through other human service organizations, and technical assistance through Department DCFS. Sorry, all the acronyms changing. It's getting to me today. So those are all ways that we do partner with that community. And so we try to make sure that there's multiple access points. So getting into those programs that are at free or reduced cost, we have vouchers that are available for a number of our programs, including social groups, social skills courses, caregiver trainings, and workshops. And I believe it's time for me to let Jonathan take over.
Yeah, do you mind advancing the slides still?
Absolutely.
Perfect, thank you. Okay, so social groups, we've mentioned it a few times now. What does that look like? Or if you'll go ahead and move to the next slide for me. We offer a range of groups where people of all ages can come and hang out and work on developing social skills in kind of a naturalistic environment with peers around the same age or developmental periods. This can look a lot of different ways. As you can see here, these are some examples of what some of our groups look like. Sometimes it's very active. People are hanging out, they're running around, maybe they're bouncing a balloon to work on collaborating and sharing and teamwork. Other times, it might just be we're all in the same room enjoying the same type of activity together, but we're doing our own thing. We're engaging in parallel play. Sometimes it's very structured with our our great staff kind of taking the lead on things, and other times, depending on the age range, it might be, hey, I'm really excited about this as a participant. Can we do this today? I'm going to touch base on a little bit more about what each of those pieces entails here in a moment, starting on the next slide. So, in terms of kind of our general social groups, these are more on the loosely structured side. You come in, you're there to work on different themes, different skills for certain groups. Typically, these are 1 to 3 hours, although recently we've been averaging closer to the 90 minutes, just because that seems to be very popular with the people that have been coming in recently. We offer this, as I mentioned before, across lifespan. So we start as early as 2 years old with our early learners. That goes from 2 to 4. We move up and we kind of break it out into those different developmental periods. So we've got our 5 to 7s, we've got 8 to 12s, we've got our 13 to 17 group, or our teen group, as we call it. And then we've got an adult group that's really 18 and beyond. And oftentimes, someone might come to us and say, hey, I really have this special interest, or I'm really interested in learning more about this. Can we have a group about that? And that's how we get some of our special interest groups. So right now, for example, we have our Dungeons and Dragons group, that has been really popular for a long time with many of our groups. But occasionally, someone will come to us and say, hey, I'm really interested in these kinds of activities. I don't necessarily want to talk about that kind of stuff, but I do want to be around people doing it so that I can have the opportunity to talk about it if I want to. That's an example of a new group that we're going to be starting this spring with our silent reading group, where we're going to have opportunities for people to come in, read kind of that parallel activity in the same space with other people engaging in the same thing at the same time. And then if they want to talk about it, we have opportunities to do so in separate spaces. So a lot of the time, the special interests are really based on what our clients and maybe even their caregivers ask us about, and we try to make it happen. Okay, and so for context, Laura mentioned that these programs have been around for a little while. The kind of background and purpose behind these started with some shared interests among our team members and an opportunity presented through the BHTC, or the Behavioral Therapeutic Tax, that came about in December of 2020 through the Pierce County Council. We were the recipients of that very generous grant. We got our initial round of funding back in 2022, and we're able to support over 3,000 individual services across approximately 1,000 individuals just across Pierce County with that support. We've recently been granted some additional funds through another vendor alongside the next round of the behavioral health tax. And so we're able to continue on doing these programs using those vouchers that Laura mentioned. But at this point in time, as far as we know, we're one of the only awardee that is actively using these funds to kind of intentionally serve the neurodivergent community that really focuses on those people with autism, ADHD, developmental disabilities, and some other co-occurring disabilities.
Yep.
And with that said, we are always looking for different places and different ways to do this. Like Laura has mentioned before, we are here to serve the community and to make those partnerships. And one of the ways that we like to serve our community is by engaging with our community and by looking for those people that can help us to support them even further and tell us where we can find those additional niches, where we can find those additional participants to engage with. Sometimes we get information from school districts and we can help there. Other times it's self-advocates or other community organizations. So we're always on the lookout for these different organizations, these different participants and partners. So if you know of anybody, or if you are someone and you have ideas about that, we would love to connect about those pieces.
Mhm.
And then really the philosophy behind our groups, we'll get into this kind of a few different ways today. But for us, and for me as I'm working in these groups, is that we're welcoming. We're here to welcome, we're here to accommodate, and we're here to support people. As Roxanne Hobbs says in this quote, we believe in supporting a wider range of normal, and only by doing that will we really benefit from the differences that our diverse minds and really our diverse community can bring. So that's kind of a big philosophy behind these groups too, is that we understand that, you know, not everybody's needs might be met in some of these other spaces. We want to build those spaces, we want to build those opportunities so that we can see those extraordinary differences. And that brings me to who should be here, who should come to these. The simple answer to that is anyone. Anyone that is neurodiverse, anyone that wants to feel welcomed, anyone that needs a safe space, anyone that's looking for community, anyone where other services might not be meeting all their needs right now, and anyone who's interested in just socializing with others, like-minded individuals, peers, someone with wildly different backgrounds. Doesn't matter. We don't require referrals, we don't require diagnoses, and we don't have any disqualifying criteria. We're here to find a place for you, ultimately.
Mhm.
What that means is that we get community members of all ages. Like I said before, our earliest groups start at 2 to 4. We go all the way past 18 and into adulthood. We're really trying to focus on presenting all ages with a safe community that they can integrate into and engage in socialization where maybe those things aren't already there. Maybe they don't have the availability to adequately access existing therapeutic or educational or community services due to any of what they're bringing into it. And that's okay. We're here to support that.
Mhm.
So I mentioned a little bit about what our groups look like and who they're for. I mentioned that oftentimes they are kind of this loosely structured hangout group, but it really depends on the group and it depends on who's in said group. So that loose structure can be very varied. It might look like what we see here on screen, where we've got a lot of cooperation, we've got a lot of critical and social skills happening. It might also look a lot like we're just engaging in things that that we're focusing on empathetic skills and problem solving. This varies widely between the groups, and usually, based on that, we can give quarterly updates. We have some upcoming spring groups coming up. Excuse me, I'm losing my voice for a second. Anyway, we have some quarterly updates coming out to the schedule for spring that we'll tell you a little bit more about in a minute.
You want me to take
So
over
this is just
so you can breathe?
I'm good for another minute or so. We'll see.
All right, sounds good. We're
So
almost done.
these are some
with
Yeah,
yours.
so these are more examples of just some of the activities that we engage in. As you can see, we've got a wide range of staff. They bring a lot of different skills and background to the table. Okay, you might have to take over. Sorry.
No problem. I got you. All right. So if we haven't pounded this in enough, our goals, one of the things that we've talked about is this is meant for anyone that wants to be here, that wants to feel safe, that wants to feel welcome, to get resources and build a community. And so that's really our goal, is all are welcome. One of our other programs that we offer is our social skills courses and youth friendship courses. And so this is a program that came out of UCLA, and UCLA did some research on this program started with young adults and adolescents, on what are those skills that are preventing some people from making and keeping friends and forming meaningful relationships, especially those people who that's something that's a really important goal for them, and they're struggling with being successful for that. And so UCLA put together this research for peers, and lo and behold, the curriculum is fabulous, and it works. Going through our 12 to 16 week program, it shows consistently that regardless of participation level, even that those skills are improved. And so we do offer peers and social skills courses for a variety of different people. One of and I added this, but it didn't come through on this slide, probably because I'm sharing. But we just finished last year getting certified for being able to do peers for preschoolers and kindergarteners. And so we're currently partnering with a local school district and piloting that across the kindergarten class right now. They're having a really fun time with puppet shows. My staff are having a really fun time with puppet shows as well, and learning those skills as early learners. And then we're also able to go into a 7th grade class and follow the equivalent age developed curriculum for 7th graders and up. And so those are the programs that we've been doing through peers, but it's really about teaching skills about making friends, handling conflicts, bullying. As you get into the adolescents and adults, there gets to be some what to do with romantic relationships, about internet use, things like that. And so this is a structured curriculum that we use for those social skills courses. And then something that's unique to Behavior Bridges is one of my fabulous staff created an interim course for those kiddos ages 9 to 12 who are kind of in that middle space. UCLA didn't have a program for that, so we made one that is similar to the peers program, but also adjusted for age, and the activities are adjusted as well to be a little bit more fun play based rather than role play based. And so we do have those programs. One of the things that we've been doing lately is partnering with other organizations, school districts, and programs, so that we're providing these programs in the community rather than having people come to us. We are able to do both, but that's been a really fun partnership with the community in the last year or so. So that's something that we offer as well. The funding for groups, as Jonathan said, we don't have any disqualifying criteria, but some people and some options do have qualifying ways to pay. And so we do accept private pay. We also are DDCS life skills providers, so we can partner with case managers to have life skills be recommended in a person's service plan and receive that funding through a life skills program. We also have those fabulous grants and scholarships currently through Carillon Behavioral Health and Pierce County Behavioral Health. And so those are ways that we can offer more free scholarships to people and vouchers so that it's completely free. And so at the moment, until June, the end of June, anybody that wants to come, if they aren't able to pay, they can have a free space. And after June, we have plenty of vouchers, and we're working on some partnerships to keep it up for everybody to be able to have access. That's my goal. We have piloted some ABA groups, and that's something that we continue to explore every quarter. And we also have partnered with school districts who have sent or paid for our groups to help with social emotional learning, extended school year, spring break options, etc. And so that's been something that's been really fun too. Any questions about our groups and courses? I did see that Grandview Early Learning Center asked about who qualifies. I think we answered that. Jennifer, that's a beautiful explanation of some of the barriers with trying to bring everything into formal ABA insurance medically necessary based services. So we're also thrilled that we get to do this on top of the services that we provide. And let's see, franchising. I'm a big fan of quality services. I have not seen franchises work well thus far, but I'm open to the idea if anybody can give me an example of how that could be done well. But quality services are my most important priority, and the more we can partner and teach to practice, that's our philosophy. Any other questions? Okie doke. Moving on. We also provide caregiver training. And so again, right now, this caregiver training is free to anybody that would like to have it. We provide workshops currently. Some of the workshops that we have that we're providing across the state are preventing and responding to challenging behaviors, setting up successful environments, managing challenging behaviors, and more. Many of the trainings that we do are also partnered and approved for continuing education credits for DDCS providers. And so providers or family members can go and come to our trainings, or we can work with DDCS to provide that training through a partnership there. And then we also currently have a partnership with Puyallup School District. So for the next, until the end of May, every week or 2 weeks, I think, we'll be in different areas of Puyallup across the district, and providing the Preventing and Responding to Challenging Behaviors series across different people's neighborhoods. So if you happen to be in any area of Puyallup, you can find those programs. We'd love to see you. We have candy and treats and all sorts of fun things when you get there, and good community talks. Here's just a couple of examples of some of the provider trainings that we have supported. It could be as simple as 2 people up to 200 people. It doesn't matter to us. It's important that we get the good information out so that people can do what they need to do and live their best life. We don't have to be part of it. We want to get the information out there. So lots of different ways to fund those trainings, and like I said, we have that generous funding and for the foreseeable future, so that many of those opportunities and partnerships can continue to be free. We'll also be starting back up our own internal caregiver trainings for different topics. Previously, we've done some on transitioning to adulthood. We did one on understanding how insurance works, and then we've done the ones that we've talked about as well. So, and we're always open to more ideas. Any questions about that? Yes, Marcella, we do. Many of the times, these trainings can be held online. The ones in Puyallup this year are in person only, but last year we did some hybrid stuff, and that was really cool. The programs that we've done at Behavior Bridges, we've done both online and in person. So really based on who wants it, we'll accommodate what's asked for. Again, we want this to be accessible to the people who need it and the people who want it, not the other way around. Okay. So consultations, we do different consultations across school districts and community service organizations, collaborating with schools to do FBAs and BIPs, which are functional assessments and behavior intervention plans, for those of you that may not know what that is. We provide a lot of staff training and professional development partnerships and coordination. We can do IEE services, but I really prefer to be on the preventative end of things. But we can do that as well and be part of those teams, and partnerships for accessing services. So we're really proud to have fabulous partnerships with all of the surrounding school districts, and we look forward to continuing that. We are also able to do some youth crisis consultations and some short-term ABA. So that's something that we're working on with our partners at Kids Mental Health Pierce County, as well as our ABA options as well. Different consulting funding options are a lot of times we'll partner with school districts, Pierce County Behavioral Health. We do provide technical assistance for employment programs and community living organizations. We are also able to partner with hospitals, behavioral health organizations, and human service organizations. Any questions about consultations? Ooh, North Sound region. Our programs for, well, there are a lot of ABA programs around the state. And as far as groups, there's a few up in the North Sound. I know Ryther has some social groups. Alyssa Burnett might as well. And there's a few up there. So there are contact informations at the end of the presentation, and we'd be happy to reach out and see if we can get you hooked up with some places. But our social groups are a little unique. So I don't know of any that are doing that exactly what we're doing. And then for the crisis services, it really is based on the need, but all of the services that we provide don't have an age cap or age requirement. How is your voice, Jonathan? Okay.
Back for the moment. Let's go. So one of the things that I get to do as the client transition specialist at Behavior Bridges is really to help fill in some of those gaps that you guys might be navigating when you're looking for services, or when you're already in services and you're like, what's next? What do I do? Or I've heard about this piece. What does that entail? Any of those questions, really. So part of my position is I get to sit down and I get to help kind of with the guidance piece, both during intake, during some, moments in time where you're like, I have these questions, and even just beyond that. So if we get to the point where you're like, maybe this portion of our services isn't the best fit anymore, that's okay. We're not going away. We're still going to be a part of your team. We're just going to operate in a little bit different capacity. That's where I step in and help to facilitate. Have you guys looked into this? Have you guys considered these things? What can I help you find that you're curious about? That kind of rolls into the other part of my job, that is service familiarization. That's really helping to get you connected with the other services, because we get these questions all the time. So we're a little bit more familiar with what is and isn't out there in terms of services. And so instead of putting everything on you, you can ask us, you can ask me, and I can help maybe guide you through that process and make you a little bit more familiar with the services through us. You also get consistent follow-up. My favorite part of the job is getting to connect with families and getting to help them so that they have one less thing to tackle during their day-to-day operations. Because ultimately, we know that everybody has a lot on their plate. So our policy is to be very consistent and to ultimately make us a place that you don't have to worry about. We also provide individualized care, and I do the same thing through working one-on-one with clients or working one-on-one with their caregivers, in order to make sure that what they need is what I'm ultimately looking for and not what I think they need, right? I engage in a lot of communication coordination, either through different services to say, like, is this a good fit for someone? This is what they're interested in, or even just through my team members. Sometimes we have people that Maybe they're done with one side of our services, but they're really interested in engaging with our social groups. I can facilitate with our in-house groups coordinator to do that, for example. And then there's all those little pieces focusing on logistics that ultimately I get to help support so that, again, we can take something off of your plate and you can focus more on those other things that really matter to you. That's the great part about my job and what I get to do. And if you guys are interested in keeping in touch, kind of like what I mentioned to Amy in the chat, you can visit our website. We have all sorts of useful information, including our newsletter that goes out every quarter. We also have a public calendar where we post information about our social groups. Voice is starting to go again. So sorry, Laura.
Okay, that's all right. And then I also have a link if people would like a virtual tour of navigating our website. And we can do that after the presentation's over. But you would navigate to that contact us, and then there's a little drop-down button that goes to registration. And our website is behaviorbridges.com. And in that registration page are some multicolored buttons, and you can click the service that you're looking for, and then it populates into a program that we use so that we have information and we can kind of get you started. One of the things about that this is that you don't have to sign up for every single button. If you're looking for caregiver training, that's of course that adult person's name or that guardian's name. And if you're looking for those other services, then or a job, then those are clearly for those specific people. But if you're somebody that you're like, gosh, I'd really like to do all three groups, social skills and ABA, you just need to do one registration. We have two fabulous administrative assistants and Jonathan and a whole bunch of other wonderful people, and we'll make sure to get you what we're looking for in the best way possible. And finally, if anybody has questions after we're all done today, we are available. So our website is on this page, as well as our general info email and our phone number. And then we're also on Facebook and Instagram, and we'll be snooping that up here soon. So does anybody have any final questions? Okay, well, we're going to stick around for a little bit if anybody does, but we're really glad that you came today, and we're happy to be able to share this information with you. I know Gina put a survey on the chat, so if you have time before you hop off, we'd really appreciate any feedback as well.
Thank you so very, very much to our Behavior Bridges friends for covering such an extraordinary amount of information in understandable terms, and then also being available for everybody to follow up with you because it's a lot of really great information. There's awesome services. I think that's evidenced by people wanting to win the lottery, and bringing the Lauras and Jonathans and the services of the world across the state would be fantastic. So thank you all so very, very much. I did drop in the chat just really quickly the webinar evaluation survey. So if you want to use that link, that would be wonderful. Another thing that I want to do is also bring our contact information up on the screen if you've got any needs that we can connect you to for Kids Mental Health Pierce County or Kids Mental Health Washington. We want to make sure that you're able to get a hold of our team that way. If you've got any kind of families that you want to connect to services, we're always happy to provide that behavioral health navigation support. That's something we're happy to do. Another thing that I just want to say is the work that so many of you are doing on the calls is something that we would also love to highlight for our partners that could have an opportunity to do a webinar. Maybe we could feature in our newsletter. There's a lot of different opportunities to be able to uplift that information. So just because of sake of time, I just wanted to put that out there. We've got a little bit of time left for our webinar in case you want to interact with our Kids Mental Health Pierce County teams, our Behavior Bridges friends. Maybe we can even do the website walkthrough, but just for the sake of time today, I'm going to go ahead and end this webinar. I wanted to say a huge thank you to our friends once more at Behavior Bridges for being here and for all of you for taking the time to join us. So with that, I'm going to stop sharing. I'm going to end the webinar here for the recording, but then we can hang out a little bit longer so that we could do the website walkthrough maybe, Laura. Would that work for your team? Great. Okay, I'm going to figure out how to stop recording and we will keep that going for everybody that needs to hop off. Thanks for being here. For everybody who wants to hang out and see that, you're welcome to do so. All right, thanks so much, everybody.